you guys have to answer also. I will be asking questions. Okay? Okay. What is this organ?
liver.
Okay. Why do you say, why are you going to make a liver again?
It can be the spleen.
Yeah. He make a spleen level liver only.
Because it's the liver.
Yeah, it's the liver, yeah. Basically, because it's the one of the largest organs. Spleen vechcha loku naha ne. Okay. And when consider about liver, how do you call in Latin the liver? Hepa. Okay. And hepa, as you can see, how many surfaces are there? 2 surfaces. What are the surfaces? This row. What are the surfaces you know of the liver? Tell me louder. One person from each row, that's enough. Fascis, diaphragmatica, and other one, fascis visceralis. Okay, this is the visceral surface, the irregular surface, but it's the more convex and smooth surface is called most convex and smooth surface is called diaphragmatic surface. Okay, and those are 2 main surfaces, and there are 2 margins. Okay, there is a prominent margin and a bit blunt margin. How do you call the prominent margin? Inferior, margo inferior. Now if you consider liver, now we have distinguished the diaphragmatic surface and visceral surface, and this diaphragmatic surface, it always faces the diaphragm. Now just imagine this, my hand is the diaphragm. Okay, so if you place it correctly in the correct anatomical position, so it should face the diaphragm, and also the inferior surface, it should face downwards. Okay, and then the inferior one, we can see this prominent margin, because here you can see this margin is not prominent, it's bit blunt. Okay, so that's why we called as this margin as margo supero posterior, because it faces superiorly and posteriorly. Okay, superior and posterior, then maybe posterior. Okay, and this one, the inferior margin, it faces the inferior. Okay, it's a bit very sharp. Okay, and in liver, how many lobes are there?
2 lobes.
Incorrect. No, how many lobes actually? 4 lobes. Okay, first row, tell me 2 lobes. Pamadakuna. The large one is the right lobe, and then there's a smaller one, the left lobe. Okay, and how do we differentiate these 2 lobes? Yeah, through the ligaments. Okay, now here you can see the prominent ligament which is seen on the anterior surface on the fascis diaphragmatica, but how do you call that ligament? Falciformis, ligamentum falciformis. It goes from it separates the anterior left and right lobes anteriorly. Okay, but posteriorly these 2 lobes are separated also, because this is a 3D structure ne. දැන් ඉස්සරහින් මොනවා හරි වෙන් කරනවා නම් අනිවාර්යෙන් පිටිපස්සෙනුත් වෙන් කරන්න ඕනේ. Posteriorly, through which anatomical structures this is separated into right and left? Venous ligament, ligamenti venosi. So that is the superior most ligament. Here මෙතන the ligament is not prominent because this පොඩ්ඩක් අවුරුදු ගානක liver එකක් අපේ batches ටික අල්ලලා ligament එකේ කැලි නැහැ. Okay, but you should remember that it is the superior most ligament in the posterior surface, in the visceral surface, and this ligament is a obliterated anatomical structure. What is that structure? Ligament venosi. It's a obliterated structure. ඒ කියන්නේ fetal life එකේදී මේක වෙන function එකක් තමයි කරේ. What? Someone tell loudly. Ductus venosus. Okay. So what is ductus venosus? Fetal circulation. What is the function of the ductus venosus? Anyone can remember? Okay, anyone? Just raise your hand. Okay, so it is, as you can remember, there are umbilical veins. Okay, so umbilical veins reach the what? Hepatic veins. It doesn't reach the hepatic veins. It comes to the hepatic veins, and from hepatic veins, in order to supply blood to the brain, there is a specific bypass, because from umbilical veins there are oxygenated blood. Okay, but if it goes and connects with the portal vein of the liver, it will get deoxygenated. But as you can remember, in fetus the lungs are not functioning. Okay, so in order to supply blood to brain, දැන් මේ කෙලින්ම එන umbilical, දැන් අපි හිතමු umbilical veins ටික එනවා. ඒක දැන් මෙතන portal vein එකත් එක්ක සම්බන්ධ වෙලා නැත්නම් hepatic veins එක්ක සම්බන්ධ වෙලා කෙලින්ම ගියොත් එතකොට දැන් lungs උත් වැඩ කරන්නේ නැහැ fetus ගේ. එතකොට brain එකට blood supply කරන්න බැරි වෙනවා. So in order to supply blood to the brain, there are specific bypasses in the fetuses, so that now umbilical vein, it comes and connects directly with the inferior vena cava without the portal veins, and then it goes to the what? Right atrium, and then there is another bypass after right atrium, then right ventricle, then there is pulmonary trunk, and ekadike giyama there is another bypass which can go directly to the blood vessels in the through the left ventricle. It can go towards the brain. That means from left ventricle there the aorta starts. No, I will after these preparations I will draw and show you, because it bit confusing I think, because there is aortic duct, and then aortic duct is located on the pulmonary trunk, and it bypass the pulmonary trunk directly with aorta. Okay, I will explain it further in the diagram. Okay, so ductus venosus, it's obliterated. Ligament venosus, it's obliterated. What? Ductus venosus. Okay, that's useful in bypassing of the blood. Okay, and so that is the superior one. And inferiorly, there is another ligament, so that is more prominent. How do you call this ligament? Anyone? Tell them. Ligamenti teres hepatis. Teres hepatis. This is also a obliterated part. Which specific part? How it is formed? This part, the teres ligament. Due to obliteration of which specific vessel? Someone? Anyone knows? Yeah. Umbilical veins. Okay. Sorry, umbilical arteries. Umbilical arteries. Okay. So sometimes in the exam they will ask, okay, how does this form? Due to obliteration of umbilical artery. And here ductus venosus due to umbilical veins. Okay. And then, so that is basically how the right and left one is separated. Okay. And then there are two more lobes which are a bit smaller in size and can only be seen in the visceral surface. What are they? Caudate lobe and quadrate lobe. So what is located more superior? Okay. So now I am pointing the forceps towards a specific structure. What is this? Which lobe? Quadrate lobe. So that is located inferiorly, and the superiorly located one is caudate lobe. Okay, and this caudate lobe, it is connected to the right side by a specific structure. How do you call that? That means here there is a specific structure which connects to the right lobe. How do you call that? It's a process. How do you call that process? Processus caudatus. Okay. Caudate lobe is connected to the right one by caudate process. Okay. And you should know about the porta hepatis. What is porta hepatis? Someone can tell? Yeah. Porta, it's a place where vessels enter certain structure. And there are some structures which comes out from the porta hepatis and which goes into the porta hepatis. Okay. This side, first row. Can you tell the structures which go into the porta hepatis? Anyone? Yeah, you guys also can tell. Yeah, proper hepatic artery, and then portal vein and hepatic plexus. Okay, those are the main three structures which goes in, and there are structures which come out. What are the Elliott structures? Hepatic ducts. Okay, so bile ducts, and bile is produced inside the liver, and then it comes out through the hepatic ducts. Okay, so you need to know those basic structures which come out and come in. Okay, and then there's a and also I forgot to tell, the places where these ligaments are present we call in specific names, these depressions. How do you call the place where the ligament venosus is present? Anyone? No, not insura, not sulcus, nothing. We call them as fissures. Fissura ligamenti venosi. Okay? This is fissura ligamenti venosi. That means the ligamenti venosi lies in this part. And then palleathina ligament teres, that lies in which? Fissura ligamenti teres hepatis. Okay? And I also forgot to mention there are some more ligaments in this structure, in this module. They are not visible, but in the margo supero posterior there is one more major ligament which connects the liver to the diaphragm, because the megaphysis diaphragmatic, it connects to the diaphragm through which ligament? Sorry?
Triangular.
No, triangular ligament is a continuation of this ligament.
Round ligament.
No, round ligament is palla. Here. Here in this structure there is no, this part is not present. That is called coronary ligament. Okay, coronary ligament, and continuation of coronary ligament on the two lateral edges is the triangular ligament. These structures, if you get anatomic atlas or something, you can see. Okay, in this structure it's impossible to show. So, and then there is another specific landmark in this region. Here it's for the damage, but here beside the caudate lobe there is specific this major blood vessel which travel through this area. Okay, what is that blood vessel? Inferior vena cava. Okay, so we call this a region where the inferior vena cava travels as sulcus vena cava. Okay, inferior vena cava, it goes through like this, so we call this as sulcus. Okay, clear everyone? Okay, and then and there's, as you can see, there is a large depression in this area in the right lobe. Okay, everyone can see, right? Large depression. Okay, back row. What is that large depression for? For which structure? Are you the back row? Back row, boys, come on. Sorry, gallbladder. How do you call gallbladder in Latin? This side, first row. How do you call that gallbladder? Second row. Tell loudly because I can't hear. You just.
Transport providers.
Yeah. Vesica failure. Okay. Oh, commonly vesica. Okay. So we call this depression as what? Sorry? Fossa of the gallbladder or fossa vesicae failure. Okay. So here it's missing. I don't know who stole that or who removed that. Don't know, maybe some seniors maybe. That's okay. Okay. What else I missed on this structure? Anyone can tell, because I also tend to forget, like you guys. What structures did I forget? Any other? Okay, there is another specific part in the liver which we called as bare area. That means in some parts it's not covered by what? Peritoneum. So we call those regions as what? Bare areas. Okay, bare areas of the liver. So, and also you should know the specific localization of structures which leave the porta hepatis. So what are the structures which enter the porta hepatis? Hepatic artery. Sorry. I don't know.
She just said. She wants to lock the room key.
Okay. So that's basically for the liver. And I'll tell the order of the structures, because in this preparate you can see also this spleen. Okay. Otherwise in Latin we can call as lenalis. Okay, lean. Okay. Can everyone see? Okay. So as you can see, in this also there is a smooth surface. Okay. This surface, if you touch, it's smooth. I can feel it, so I'm telling it's smooth. Okay. And then this is bit irregular, like same like in liver. This is the visceral surface. Okay. And in this organ too, there are two surfaces. First is diaphragmatica, diaphragm surface, and the visceral surface. Okay. And as these are unpaired organs, through how many points we can correlate the correct anatomical position? 2 points. Okay. Specifically for spleen, so the first one is the surfaces. Okay. So now the diaphragm, this is the spleen is located more on the left side and laterally facing the diaphragm. Okay. So I put it on the lateral. The lateral side is the diaphragmatic surface, and the visceral one, it faces downwards. Okay. And and also guys, can you tell me between which ribs this spleen is located? The skeletal rib? Anyone can raise your arm and tell loudly. Between which ribs this spleen is located? Skeletal rib of the spleen. Anyone? 9 and 11. Okay, 9 and which is located between 9 and 11 on the lateral side. Okay, and we have differentiated the visceral surface and diaphragmatic surface, and there are 2 edges. Okay, 2 edges in the spleen. The more blunt one we called as what? Sorry. The more blunt edge is the inferior edge. Okay, and on the superior edge there are some cuttings like those things, 2 or 3 maybe. And then, so now we know if we can find those cutting edges, and then we can correlate it as what? The superior margin. And then inferior one, it faces always inferior, and it's a bit sharp also, and no cuttings. So therefore inferior. So through this we can correlate. Now here, I think it's a bit smaller, but here there are so cutting, so this is I consider as the superior margin. So now I know the surfaces and two superior and inferior margins, so I just it's located like this with respect to my body. Okay, and this spleen, is it what can you say about the peritoneal coverage of spleen? Sorry? Yeah, you're correct. It's intraperitoneal except for the one place. What is that place which is not covered by the peritoneum? This side? Anyone knows? Which part is not covered by the peritoneum? Sorry? Anyone? Which part of the spleen which is not covered by hilum? Yeah, hilum is not covered. So in the hilum, what are the structures you can see? Artery and the vein. Okay. What is more superficial? Vein is more superficial and artery goes product deep. Okay. So within this is a parenchymal organ. Within this, there are two types of pulp or the parenchymal tissue. How do you call that? Red pulp and white pulp. What is more prominent? Which pulp is more prominent? Why? Why are you saying like that? White pulp prominent කියලා. No, actually most prominent is red pulp, okay? Because now spleen is called as one of the main, that means is called as the graveyard of the body. Why we call it as the graveyard? Red blood cells are destroyed. Okay, so there are more red pulp is there to destroy red blood cells and less number of white pulp. And this white pulp, when we consider, it mainly contains what? Now, atana RBC destroy karuna. It is we called as red pulp. White pulp killa kiyanne? Sorry? Yeah, lymphocytes and lymph aggregation are there. That's why it's called as white pulp. Okay. So now I think you can identify the spleen easily. Next one, what is the structure? Yeah, esophagus is there. No. Tongue and the trachea. Okay. Esophagus එක අයින් කරලා. හරි. එතකොට මේ tongue එකේ what are the parts of the tongue you know? So anterior most is called apex, and then this middle part body corpus, and the third part what? Radix or the root. Okay. And then we called the anterior surface as what? Cut it. Dorsum. We called as dorsum. And in the dorsum, we can see various papilla. What is the papilla which is located on the tip of the tongue? Filiform papillae. What is the function of that? Tactile sensation, yes. That is the only papillae which is specialized for tactile sensations. Okay. And then on the margins and on the anterior sides, there is other type of papilla. What are they? Fungiforms, circumvallate. Vallate na. Fungiform and other one foliate. Okay. Foliate papillae also localized on the anterior 1/3 of dorsum and on the margins. Okay. And there is a specific papilla. I think you can see like body blisters again. නිකන් V shape එක තියෙන papillae වර්ගයක්. That we called as vallate papilla. What is the function of vallate papilla? Sorry?
Test.
That's also test, because only which papilla specialized for tactile? Filiform papilla. Okay. Other all type of papilla, they are specialized for what? Taste. And can someone remember what is the blood supply of the tongue? Blood supply of the tongue? Lingual. Okay, this side. Which nerves supply tongue? How many nerves do you think supply tongue? this side. Wait, you guys, because this side, only this side is noisy today and this side nothing. So, guys, please now, which nerve supply? Does anyone know? No, right? Okay, I'll tell. So, the main, there are some tongue muscles, no? So, the main nerve which supplies the tongue muscles are the, no, facial nerves supply, but hypoglossal nerve, because same name, nerves hypoglossal, because there is the main muscle, one of the main muscle, hypoglossal muscle, and also as you mentioned, the facial nerve supplies to the other muscles, and also the trigeminal nerve. Okay, which branch of the trigeminal nerve supplies? Maxillary. No. Mandibular, yeah. Okay. And also, there are some folds which what is this structure? tongue එක තියෙනවා, tongue එක පිටිපස්සේ radix එකක් තියෙනවා, radix එක පිටිපස්සේ තියෙනවා මෙතන specific structure එකක් පොඩ්ඩක් අර ඉස්සෙල්ලා වගේ. Epiglottis, okay? This is epiglottis. Right? Now this tongue connected to epiglottis through 3 folds. Okay? The middle fold, which I think පිටිපස්සේ කට්ටිය පේනවා shape එක. That is plica, what? Plica glosso-epiglottica. That means starting from the tongue is glosso, and epiglottis same name. So plica glosso-epiglottica mediana. That means this is the median fold. Okay, and then on the 2 sides there are other 2 folds. How do you call that? Lateral. Plica glosso-epiglottica lateralis. And I need you guys need to tell what is the spaces. Then there are 3 folds ne. Then මේ folds 3 අතර there are 2 spaces. How do you call that space? Velicule. Yeah, we call it as velicule. Okay, and that is basically the tongue parts. This the larynx one you will learn in the respiratory part. Okay, next about the pharynx. Okay, I think we're done. Okay, so as you know, the oral cavity, it consists of 2 parts. What are the 2 parts? This side. Now you already learned vestibule, the initial part, it's damaged, can't help. And then this part, this is called as oral cavity proper. Okay, oral cavity proper. And this extend towards the posterior side, and here it connects with which part of the pharynx? Oropharynx. Okay, so pharynx, how many parts does it contain? 3 parts. What are they? Nasal part and laryngeal part. Can someone tell specific skeletotopy of these separate parts? Now first let's talk about the nasopharynx. Yeah, base of the skull, that means the sphenoid bone, that means somewhere like here. Okay, and it extends towards the oropharynx. So what is the landmark between oropharynx and the nasopharynx? Which vertebra? We can be using vertebra, we can say C3, C2, or either C3, maybe vary. And then the oropharynx, it continues from C, usually we take as C2. Okay, the between the landmark, the point between the naso and the oropharynx. And from naso and laryngopharynx, that's C3. Okay, that is the landmark between C3. And then the laryngopharynx, it continues with which structure? No. Before trachea, what is the structure located? Larynx. Okay, so it continues with larynx. Yeah, that's basically it. It's number shape. Stomach. Okay, so what do you think? What is this part? Extended part. Okay. So when determine the when you positioning anatomic in the when you are keeping this organ in the correct anatomical position, always use the horizontal surface, because I can't do that. I am using in the vertical manner. So as you can see, there are two curvatures. What are they? As you can see, the lesser one and greater curvature. Okay, so bit difficult with this structure also, because it's almost divided into half, like a madumalu wagela kiya. So but okay, this is the lesser curvature, and then the cut is divided into two is the greater curvature. Okay, and what is this part? Is sorry, not esophagus, duodenum, folds, circular folds. Okay, and you can't find the esophagus, so but here you can just point out that here the ostium is there. What is the ostium present? The initial inlet of the stomach we called as cardiac, ostium cardiacum. At which level this is present? T11, yeah, good. And then the other outlet of the stomach is called as ostium pyloricum. Okay, ostium pyloricum. And as you know, the stomach, it's located more on the left side, and the lesser curvature is more towards the medial side. So you can place this then esophagus එක පල්ලයට දැම්මා, and here you sorry, you put the duodenum and small intestine parts downwards, and here you can't find the esophagus, so it's okay, because we have the duodenum, so it's okay. So we keep the lesser curvature more towards the medial side, because you should know, the basic point is you should know the stomach is located more towards the left side. Okay, and then the greater curvature, it faces laterally. Okay, and then you can identify the two surfaces, anterior, posterior. So like this, if someone tell to keep in the correct anatomical position, don't keep like this, but keep on a horizontal table or something, because now I'm showing you, I'm keeping like that. This is the correct anatomical position of the organ. And also, and as we earlier discussed, usually when you observe any organ, before determining which organ it is, just examine the internal structure and the external structure. Are there any specific anatomical landmarks or something which we can differentiate that organ? Okay, so why did you say this is large intestine? Why did you say? Yeah, these are small extensions which are present on the external surface. We called as epiploic appendices, epiploic. What is the function of this? Now you know these structures, but at least there should be any function. No, not protection. Yeah, they store fat, so that is they help in storage of fat. And internal surface, difficult to see the coli. Okay, what are the coli? Tinea present? tinea aumentalis, that is connected with greater omentum. And then other one, mesocolica, that is connected with mesentery. That's okay. And the other one, which is not which has no any connections with any other structure, that is called tinea libera. Okay. So due to these libera, these teneas, what happens to the structure of the large intestine? It gets sacculated. So why do you think this is actually sacculated more?